Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, understanding prescription abbreviations. You may have seen prescription abbreviations like QD, HS, or BID on your medication labels. These abbreviations are derived from the Latin words for every day, at bedtime, and twice daily, respectively. /r/n/r/n. Perhaps one of the most common is Rx, the official symbol for prescription. Thought to be derived from the Latin word for recipe, this abbreviation relays to pharmacists that a prescription is authorized to be filled. /r/n/r/n. Your pharmacy will translate your healthcare provider's instructions on the medicine's label. Sometimes, a mistake can happen, and a shorthand abbreviation will appear on your medication. Here's a list of common abbreviations and the ones you're most likely to see on home medications. /r/n/r/n Verywell, Ellen Lindnerrnrn Rx is an abbreviation for prescription. In the US it is believed that origin of the symbol is an abbreviation of the Latin word for recipe, which means take. /r/n/r/n in Europe, another suggestion of the origin of the symbol appears to represent the astronomical sign of the planet Jupiter. /r/n/r/n. According to another theory, the Rx symbol is based on the Roman deity Jupiter. Jupiter's symbol looked similar to the Rx symbol. The symbol may have been placed on a prescription to invoke Jupiter's blessing. /r/n/r/nPx and Rx are often confused for one another. However, PX does not mean prescription like Rx does. Depending on where it is used, PX can be a shorthand for prognosis or for procedure code. As a procedure code, PX will precede a numerical code that represents a specific medical procedure indicated for a patient. /r/n/r/n. Here is an example of what a healthcare provider might write on a prescription. /r/n/r/n sick, 1 tab poked PC and HS/r/n/r/n. These abbreviations are instructions for taking the medication. The pharmacist will translate them for the medication label. In this case, the instructions will read, take 1 tablet by mouth 4 times a day, after meals, and at bedtime. /r/n/r/n. The abbreviations may be written in capital letters or small letters, and may or may not include periods. /r/n/r/n. It is unlikely that you will see Latin-based prescription abbreviations for medications you take at home. If they are on your prescription, your pharmacist is responsible for reviewing your medications with you and counseling you to ensure you understand your home medications. /r/n/r/n. If you ever pick up a prescription and see shorthand like these abbreviations, double-check their meaning with the pharmacist to ensure you take your medications as prescribed. /r/n/r/n. There are well over 100 prescription abbreviations. A shortened list of prescription abbreviations includes the following: /r/n/r/n. The Latin terms are still in use, but some healthcare providers are retiring hem. It is becoming more common for healthcare providers to write prescription instructions in plain language. /r/n/r/n. Readable prescriptions can help prevent medication errors. That is why many medical professionals believe written instructions should be used instead of hard-to-read abbreviations. /r/n/r/n. For example, the abbreviation QD, which means daily, could be mistaken for ct, which means 4 times a day. It could also be confused for odd, which means right eye. Simply writing daily prevents confusion. /r/n/r/n. Eprescribing, or electronic prescribing, can also help prevent medication errors. Instructions sent directly to the pharmacy electronically are less prone to human error. If your healthcare provider uses electronic prescribing, you may never see the abbreviations. /r/n/r/n. Eprescribing improves patient safety in a number of ways, such as :/r/n/r/n. Prescription abbreviations like BID, which stands for twice a day, and Rx, which stands for prescription, are commonly used by healthcare providers when detailing prescription drug information in shorthand. /r/n/r/n. If you receive a written prescription, make sure you understand the directions. If the directions are unclear or confusing, ask your healthcare provider or pharmacist to explain. Don't take chances. Ask a medical professional what the shorthand means before you take the prescription home. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.